Hi guys, this video is about patello-femoral pain and how you can change your running style to actually help your recovery. And especially if you're struggling to get back to running without pain, then this video may help you. What I'm going to cover is I'm going to give you a quick recap of what patello-femoral pain is, also called runner's knee, and the main causes. What causes patello-femoral pain in runners to develop? Then we're going to look at what running style issues may contribute to it. And then lastly, methods that you can correct it and improve your running style. Good, so for those of you who don't know me, my name is Maryke. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of your injuries. If you want to know more about it, just check out the description of this video. Link to my website is there. Okay, so patello-femoral pain is pain over the front of the knee. There can be other causes for pain over the front of the knee, but it's one of the main ones in runners. And it's the kneecap that's causing the pain there. So the kneecap tracks in quite a shallow groove and it moves up and down as you move your leg. Now what happens is sometimes the kneecap takes a bit of strain on one side or the other because of how your leg moves when you move and when you run. And if you excessively move your leg into certain positions, you may cause parts of that kneecap to overstrain and cause the pain. So causes for patello-femoral pain, biomechanics is being blamed definitely. So things like your hip turning in too much when you run, I'll demonstrate it in a minute, or your knee coming in too much or moving over too much, then your pelvis dropping. Also other things in the running style that can be a problem is if you overstride, so causing really high forces through your leg as you run, or if you make really hard contact with your heel when you run. Then another cause is if you have weak muscles. So if your quad muscles aren't strong or your glutes aren't strong, that can contribute to it. And then other things like just increasing your training load too quickly. So overtraining, stuff like that. What the research is showing is that there's not one thing as treatment that's superior to the other. And it usually takes a combination of it all. There's been studies to show that pain can decrease if you strengthen the runners up. Pain can decrease if you just change their running style or just through rest also sometimes. Interestingly enough, what the studies also show is if you improve muscle strength and you make them stronger, that doesn't translate to better running styles. So if you test them before you strengthen them, test them after you've strengthened them, they still have their bad biomechanics when they're running. And vice versa for running style, if you change their running style and they adopt a better running style, when you test their muscle strength, they haven't really gained anything in there. So you've got to address both issues at the same time, preferably. Good, so let me just see, where am I going with this now? So the factors that can affect it, let me demonstrate it to you and then you'll understand why it affects it. The easiest way, by the way, to know how you run, there are two ways that I find useful if you want to assess it yourself. One is if you're running on a treadmill, get somebody to film you from the back, but also from the side to see what your legs do and how they move. But a second one can be, if you go out for a run, just get a feel, observe what you feel when you run. That can already tell you quite a lot about your running style. So when we run, you carry your weight, you make contact, weight on one leg while the other one is in the air. Now, this supporting leg, it's been shown, if my hip drops a lot and this angle increases, I'm just going to stabilize myself with a wall, that it moves over, that can affect the tracking of your patella or your kneecap. And then if you add that the knee turns in too quickly or excessively, that can really strain the kneecap where it's running in its line there. And those are the three main movement patterns around the hip that's been shown to contribute to it. Then also, if you overstride, so place landing with your foot quite far ahead of your body, that can cause increased forces in the kneecap. What is the last one now? Oh yes, and that kind of goes hand in hand with hard heel landing, so really planting your heel in as you run. Again, that can cause high forces on the kneecap. So, how do you fix this? Now, I tend to always want my patients to first get a decent amount of muscle strength before I get them back to running. Usually they need to have a little bit of a break in any case because of symptoms, but if your symptoms aren't that bad, you may be able to continue running while your rehab is ongoing. So definitely look at muscle strength, strengthen up the muscles that you need if they're not strong. So that's usually your glute max, glute med, and quads. That's the most important. Then I prefer to teach my runners their pattern in standing first, because what I often see is if I just tell them to turn their knee out a bit when they run, they initiate those patterns from the wrong places. So for instance, I wonder if I can do this without changing the camera angle. If your leg moved in excessively when you run, you're meant to correct it with your hip muscles, that it turns it out a bit more or just doesn't allow it to turn in that much. So the movement should happen from there. Now, if you're quite used to not controlling that movement and using adaptive methods, your brain may not understand how to isolate the movement to the hip. And that's why it's quite useful to work with exercises like starting with a silly old clam exercise at the beginning just to get the feel, but then progressing to things like single leg squats, supported squats, depending on your level and your ability. But definitely, and of course your pain, so be careful, because if you're doing single leg squats with a very irritated kneecap, you're going to make it worse. So it's got to be pitched at the right level for you. But yes, teaching yourself, how do I actually correct this movement? How do I stop my leg from moving in too much? Because what you don't want to see is, you don't want to see now, because you're trying to turn your leg out so much, you're suddenly running with your feet turning out. Your feet should still be able to point forwards. It should just be your hip that turns out, but the foot shouldn't necessarily change. Again, that advice may be different per person. So definitely practice those patterns first before you try and do it while you're running. Then the next bit is that in order for you to correct something, you need to really understand what you're trying to correct. And I really, really would urge you to try and get some video feedback of yourself running, that you can just have a look and see. And if you can't see if there's anything wrong or not, get somebody who's used to looking at these things to look at it for you. So for my online patients, I just get them to video themselves from the side and the back, and they email that to me or send it via text message, and I can look at that for them and explain what I'm seeing. So once you're aware of what you're seeing and what you want to correct, then it's much easier to feel it when you run. Also, if they don't have access to a treadmill that they can properly video themselves for running for a while, I just get them to observe what they feel. What do they feel their hips are doing? Do they feel that it's going like that? Get somebody to run behind them and comment on it. Usually it's quite easy to feel if your leg turns in quite excessively, and you may even find that one leg does more than the other leg. So just observe. Remember, you can't run without any turning in. It's just excessive turning in that you want to avoid. So we're not looking to correct it 100%. Even just a little bit of a decrease is what you're looking for and can make a difference. Okay, so you've identified what patterns you want to change and which things you think you need to work on first. Then how do you go about it? So there's usually 3 phases to running retraining. The first phase, you often have to use a lot of feedback. Now, I just have to apologize. If you're hearing a funny noise, it's the beetles in the trees that's gone berserk because it's such a hot day and I'm really struggling to speak louder than them at this point. Okay, so phase 1 is about teaching yourself that new movement pattern. It's really useful. Use feedback. So if we think of things like, again, video can be good so that you practice it a bit, take a video and you see what the effect is. Running in front of a mirror, so having a mirror in front of your treadmill can be a useful feedback mechanism as well. Somebody standing behind you, giving you cues, can be a useful mechanism. If we think of cadence and things, I'll come to that in a minute, your running watch can tell you about how much contact you're making with the ground. But yes, I'm getting ahead of myself. So during that first phase, you've really got to think about it. Second phase of running retraining, you usually reduce how much you look at your watch and all the other cues, and you just start it starts to become more automatic. And then you enter the third phase where you've now got a new pattern that you've learned and you just do it automatically. You don't even have to think about it anymore. So let's see, how can we change these things? So if we think about the first thing in the research that's been shown to be quite an effective cue to reduce several types of running injuries is increasing your cadence. So cadence is your step rate. So how many times do your feet make contact with the floor while you're running? And the reason this helps is if you are increasing your step rate, it means your feet are spending less time on the floor and there's less impact forces being created. Also, there's less time for that knee to turn in or the pelvis to drop. So increasing your cadence is probably the best place to start. But it can be very difficult to do that because it's not a normal thing for you to do. So there are strategies you can use. I've written a whole blog post about this before, but first of all, you want to figure out what your cadence is at the moment. So if you've got a fancy watch, you can just look at your data from before and it'll tell you your cadence. But if you haven't got a watch, it's as easy as counting. So you count how many steps you give in 1 minute. Then, usually what works the best according to the research is if you choose a step rate that's about 5 to 7.5 or 10% more than what you're doing currently. So not a massively increase, just a few steps per minute more. And once you master that, you can increase a bit more, depending on who you are and what your goals are. Things that can help you with that is, because I don't think you can count that fast continuously, it'll drive you nuts. But looking at your watch, so seeing what your current step rate is as you go along, that can be a very useful one. Also, if you download a metronome app on your phone and you set it to the new rhythm that you want and you try to step according to the rhythm, that's been shown to be quite a useful way of doing it. Okay, so that's increasing cadence. Yes, and the research has shown it reduces impact forces, rotation, hip adduction, as well as pelvic drop. So all in one, great adjustment to make. Then the second is, with regards to how much your legs turn in, just thinking about keeping your kneecaps pointing forwards when you're running can be a very important cue. So you're not thinking about controlling your feet or anything like that. You just think, are my kneecaps pointing forwards as I run, or am I whacking them in as I go along? So that can be a useful cue to work on. Then, with regards to impact forces and overstriding, so if you look at your video, you see that you make contact with the ground quite far ahead of you and you can feel that you're really planting your heel into it. I would caution against trying to think about running on your midfoot or front foot, because it's very easy to go and overwork your Achilles tendon and your calves by thinking about how you plant your feet. What I find a gentler method is if you lean forwards from your trunk and then think about making contact with your foot right underneath yourself, so under your center of gravity instead of in front of you. You'll find by doing that, you automatically make contact with the ground more with your mid to front foot. And it's not that kind of artificial landing on the toes situation that you get. So let me see if I can demonstrate this for you. Because when I say leaning forwards from the trunk, I don't mean collapsing your spine. You still want to keep a straight back. So I'm going to use the wall to stabilize me, because I'm obviously not running. So if you find that you're running quite upright and you make contact in front of you, like that, what you could try is you just lean forwards a bit more, and you'll already feel that kind of propels you to run forward, so it takes less action. So you're leaning forwards, so you're not collapsing forwards, you're literally leaning forwards. And when you make contact with the ground, you aim to make contact about there, so kind of more underneath you. And you can practice that by, I'm going to show you here, I've got my bed in the extra room. So if you hold on to something, it'll be best, kitchen counter or something will work better than this. And you just practice. I learned this from a podiatrist I work with. He calls it the raging bull. And you practice making contact underneath you. So you're like a bull, getting a bit angry. And you aim to make contact underneath you. So you're just getting an idea of what you're aiming to do when you're running. And this can be a great part of your pre-run warm-up. So you don't have to do it as an extra thing in the week or anything like that. You just do your normal warm-up and then you add a few of those in, that you train your brain. Think about, picture what you want to be doing. If ever there was a case to be made for mental imaging before you do a sport, then running retraining would be a great one for that. Because if you can picture in your head what you want to be doing with your body as you run, that will help you to translate that to your running. Excellent. I hope I haven't left anything out, but I think that's about it. If you've got any questions, feel free to message me or ask them in the comments. But also, if you need more help with your running style or your injury, you're always welcome to consult me via video call. Take care.